the global public health community is turning its attention to Argentina, where an unprecedented ecological shift is triggering severe concern over the spread of hantavirus. Reports from across the country indicate a massive surge in the wild rodent population, a phenomenon known locally as a rat boom, which has significantly increased the risk of viral transmission to humans. Hantavirus is a severe respiratory and systemic illness carried primarily by specific rodent reservoirs, which shed the virus in their saliva, urine, and feces. Unlike many common viruses, hantavirus is typically transmitted to humans through the inhalation of microscopic airborne particles, or aerosols, created when dried rodent excreta are disturbed by sweeping agricultural work or clearing out confined spaces. Once inhaled, the virus targets the endothelial cells lining human blood vessels, leading to high fever syndromes, acute respiratory distress, or hemorrhagic complications that carry remarkably high mortality rates. This current surge is drawing urgent focus because the scale of the rodent population explosion threatens to overwhelm traditional rural containment boundaries, pushing infected animals into closer proximity with suburban neighborhoods, regional transport hubs, and agricultural processing facilities. Public health agencies warn that the sheer volume of viral shedding in the environment makes this an escalating crisis, creating a high-density reservoir of infection that the international medical infrastructure may not be prepared to handle if the geographic footprint expands further. At the core of the response are local surveillance networks, provincial health clinics, and specialized laboratory infrastructure working to track and diagnose a growing number of suspected cases. Epidemiologists and hospital workers are operating under severe pressure, utilizing diagnostic protocols such as polymerase chain reaction tests and serological assays to confirm hantavirus infections, which often mimic standard flu symptoms during their early stages. National health authorities and international monitoring bodies are closely reviewing data from the affected Argentine provinces to determine if the virus is exhibiting standard localized transmission patterns or if there are signs of increased person-to-person spread, a rare but dangerous characteristic observed in specific South American strains like the Andes virus. Clinical centers are adjusting their triage systems to isolate patients presenting with rapid onset breathing difficulties who have a history of rural or semi-urban environmental exposure. Meanwhile, laboratory scientists are analyzing viral samples to check for any genetic mutations that might alter the severity of the disease or its transmission efficiency. The operational reality on the ground involves a difficult race against time, as official statements from regional ministries emphasize severe resource constraints, a lack of specialized antiviral therapies, and the heavy reliance on intensive supportive care, including mechanical ventilation, to keep critically ill patients alive while their bodies fight the infection. Controlling the spread of hantavirus depends heavily on aggressive environmental management, public education, and rigorous surveillance. Health departments are issuing urgent guidance to residents and workers in high-risk zones, emphasizing that prevention is the most effective tool against a virus with no widely available cure or specific vaccine. Public health campaigns advise individuals to avoid creating dust when cleaning areas with suspected rodent activity, recommending the use of disinfectants and wet mopping techniques rather than sweeping or vacuuming, which can lift infectious aerosols into the air. Long-term management requires securing food supplies, sealing structural gaps in homes and warehouses, and establishing systematic rodent trapping and monitoring programs around human settlements. Significant uncertainties remain regarding how long this rodent population boom will persist, and whether seasonal weather patterns or environmental degradation will drive the infected animals into even wider territories. As research institutes continue to study the ecological triggers behind this crisis, global health authorities stress the need for constant international vigilance and rapid information sharing to prevent a localized outbreak from evolving into a broader international threat. For more updates on developing global health situations and breaking international news, consider subscribing to this channel. At the core of the response are local surveillance networks, regional health clinics, and specialized laboratory infrastructure working under unprecedented pressure to track, isolate, and diagnose a growing influx of suspected cases. Epidemiologists and hospital workers on the ground are operating under strict protocols, utilizing advanced diagnostic tools such as polymerase chain reaction tests and enzyme-linked immunosorbent assays to confirm hantavirus infections, which are notoriously difficult to distinguish from standard influenza or other tropical fevers during the critical early stages of incubation. National health authorities and international monitoring bodies are actively reviewing epidemiological data coming out of the impacted Argentine provinces to determine the exact trajectory of the outbreak, specifically looking for indicators of whether the virus is maintaining its standard rodent-to-human transmission pathways, or if there is an escalating risk of person-to-person transmission, a highly lethal capability previously documented in specific South American lineages such as the Andes virus. Clinical triage centers are rapidly modifying their intake systems to immediately isolate any patients presenting with rapid-onset breathing difficulties, low blood pressure, or sudden thrombocytopenia, who also report a recent history of rural, agricultural, or semi-urban environmental exposure. Inside the laboratories, virologists are sequencing viral genomes from patient samples to monitor for any genetic drift or mutations that could alter the virus's virulence, transmissibility, or incubation period. The operational reality detailed in official statements from regional ministries highlights severe resource constraints, including a critical shortage of intensive care beds, limited access to specialized extracorporeal membrane oxygenation equipment, and a lack of approved, targeted antiviral therapies, leaving clinicians dependent entirely on aggressive supportive care and mechanical ventilation to keep critically ill patients stable as systemic vascular leakage progresses. Mitigating the international risk of this hantavirus surge depends heavily on aggressive environmental control, updated public guidance, and rigorous cross-border surveillance. Health departments globally are updating their protocols, emphasizing that prevention remains the primary line of defense against a pathogen with a case fatality rate exceeding 35% and no widely available specific vaccine. Public health guidelines stress that in regions experiencing a rodent boom, or ratada, individuals must avoid creating dust when cleaning spaces with suspected rodent activity. Standard protocols dictate wetting contaminated areas with a bleach solution or disinfectant rather than sweeping or vacuuming, which can inadvertently lift highly infectious viral particles into airborne aerosols. Long-term risk reduction requires systematic structural interventions, such as sealing structural gaps in residential and commercial properties, securing agricultural grain stores, and deploying widespread trapping networks around human settlements. Currently, severe biological and geographic uncertainties remain. A primary focus of field researchers, including teams from the Malbrán Institute, involves checking if climate-driven environmental changes are forcing the reservoir species, the long-tailed pygmy rice rat, to expand its range into previously unaffected territories, such as the southernmost regions of Tierra del Fuego. Simultaneously, global tracking networks face the complex task of monitoring international air travelers who may have shared close, confined environments with symptomatic individuals, given the unique person-to-person transmission capabilities of the Andes virus strain. Navigating this outbreak requires balancing aggressive containment with ethical public communication, avoiding localized panic while maintaining the transparent, rapid data sharing necessary to prevent further international spread. For ongoing coverage of developing international health crises and official epidemiologic updates, consider subscribing to this channel.